welcome to another chat with your fertility specialist. And I have fertility experts from Alps Hospital and Diagnostics, Dr. Kenneth Oguba and Dr. Deborah Olibiyi. This morning we'll be talking about something very exciting. Yes, we're talking about when an IVF succeeds. Hey, yes, there's always so much excitement when an IVF succeeds. So, Dr. Ken, when do you say an IVF has succeeded?
All right, so we say an IVF treatment has succeeded if an ultrasound scan revealed fetus or fetuses with cardiac activity.
Wow.
Then we say an IVF has succeeded.
Okay.
Yeah, because the reason for IVF is to achieve pregnancy,
Pregnancy.
and that's pregnancy there for you.
Okay.
So in that case, yeah, IVF has succeeded, and not just the pregnancy test.
Not just the pregnancy test.
Exactly.
Okay, so does it mean that you could have pregnancy positive, but then everything may.
Exactly, and it disappears soon after.
Oh, okay.
Yeah, that way we talk about a failing pregnancy or a chemical pregnancy and all of that. But the real evidence that IVF has succeeded is having evidence of
Fetal
fetal heart
activity.
activities on an
Okay.
ultrasound. That's to say you see fetal pool or fetal pools, then with cardiac activities, and that's pregnancy. Yeah,
Okay. Oh, wow.
so it succeeded.
Oh, great. So, Dr. Debbie, what precautions? Are there precautions for an IVF pregnancy? Are there things that the client should know when they have an IVF or when an IVF has succeeded finally and everything, every fetal activity is normal? Are there things that they are supposed to do?
Yes, there are some precautions. An IVF pregnancy is a very special pregnancy. It's a pregnancy that most times usually comes out after years of trying to conceive. Yes, so
Yeah.
there are precautions the clients should take. We encourage them to live their normal lives as much as possible, but they should avoid strenuous activity. And it's very important that they listen to the counsel of their physicians, because as they're checked, there might be instructions that their doctors give to them. They need to
Okay.
take, heed to those instructions. Some might be told to still abstain from sex. Maybe they're still bleeding, having vaginal bleeding or spotting, or the physician notices a low-lying placenta. They might be told to still abstain from sex. And at this time also, it's very important that they keep taking their drugs. There are some special drugs that they are given. We call them luteal support drugs
Okay.
to support the pregnancy at this stage. At this early stage, the placenta is not fully formed. So there are some hormones they need to be taken in form of medications to support this pregnancy for a certain time, usually till about 3 months of pregnancy. That's 12 weeks. At this time, we expect the placenta to take over this function and be producing those hormones in adequate amounts. Yes, we encourage them to eat an adequate diet, a well-balanced diet, a lot of fruits, a lot of vegetables. You hear some women saying they're lying down. No, they should live their normal lives. Just avoid very strenuous activities. Those are some of the precautions.
Amazing. So, Dr. Ken, how about you? What do you have to say about that?
Well, in the first place, I want to make adjustment to when IVF succeeds.
Okay.
So, first part of the success is to have pregnancy tests
Okay.
positive. Okay, so those who have positive pregnancy tests wouldn't say because Ken said
Said
that you have
until
to have ultrasound scan, and so this is not pregnancy. And that's the first aspect. The first thing to be done is the pregnancy test. When it's positive, it's prospective. And then a week or two later, this ultrasound scan is done to confirm whether there is a cardiac activities and fetal pools. Okay, and so that is a real IVF success. All right. So she has mentioned quite a number of things that they have to do. They have to stick with the medications that they've been prescribed, the luteal support medications. And they come for their regular checks with their gynecologists, who monitors them and take care of all the signs and the symptoms of pregnancy that may be a little bit exaggerated
Okay.
because of the medications
They've been on.
they've been on and because of also the pregnancy or number of pregnant fetuses they are carrying. So they need support, and all that. Support from their spouses too and the medical team. It's
yeah,
not a time to stop medication
Okay.
or to rejoice and be careless about how you live your life.
Yeah, and
Well,
some
IVF. Okay, do you have?
yes, and sometimes we counsel that they have a cervical sacrilege too. That's
Okay.
one of the counselings we get, especially when there are multiple fetuses, and even if there is just one baby, sometimes it is indicated that they have a sacrilege. That's just tying of the womb
Yeah, I
to
was about to
prevent
say maybe
preterm,
you should make it a
yes,
little bit
labor
more
and
late.
delivery. Yes, so that might be they might be giving that counsel to have that done at the appropriate time too. Yes.
Especially when there is a history suggestive of cervical insufficiency, about the weakness of the cervix. Okay, you really want to talk to them to have this thing done. Because you have all the histories before the IVF is done. Some may have lost some pregnancies before IVF, losing pregnancy in the second trimester. Maybe suggestive of cervical problems. So you want to take a look at that and advise for sacrilege.
Oh, amazing. I've heard clients say that, so because my IVF has succeeded, will I keep having all my children through IVF? Can they conceive just without an IVF treatment after a successful IVF?
Yes, they can. So it depends on the indication for the IVF. Some of the indications for the IVF might not be things that are reoccurring. There are some absolute indications for IVF, like bilateral tubal blockage. So if a woman's tubes are blocked, there's no way she can conceive spontaneously. So for that kind of woman, she will still need to have an IVF for another pregnancy. But there are some indications that are not reoccurring. And, we've even noticed that after undergoing some fertility treatment, people are even able to conceive spontaneously on their own subsequently. So it's not an absolute something for everybody. Yes, it depends on the reason why the IVF was done in the first place.
Usually, this is better for the younger age group.
Okay.
Because if you're well advanced in age, I will always will be on the side of be active, trying to get pregnant. And one of the ways to be active is by doing an IVF as soon as possible. Again, instead of just waiting indefinitely.
Yeah.
Because when you're young, you have enough time to wait. Just as you said, if it's not a reoccurring a reason for IVF. Okay, so yeah, we have a good number of people who conceived spontaneously after an IVF, and some also who conceived spontaneously after a failed IVF.
Oh, wow.
Yeah, so it's just like that.
Okay, so can you just give us a glimpse into what it looks like in your consulting room when an IVF has succeeded?
Oh my God.
Yes,
It's a happy day. A happy day.
Oh, happy day!
I had a woman just a couple of days ago. Okay, over the weekend,
Yeah.
I ran clinic
Okay.
just 2 days ago. I mean Saturday, 3 days ago. And she had come from the northwest or northeast part of Nigeria, and then she's been in Jos the entire period and decided she was not going anywhere
Some of
until
them refuse to
pregnancy
go
test.
anywhere.
Usually
They
those
want to hang on you. They refuse to go.
those acts actually scare you sometimes,
Yes.
because if it turns out negative, it makes it very painful,
Yeah.
because you've invested so much emotion, time, monies, and all of that. So when it succeeded, of course, my clinics are usually busy, so I like pushing. But that day I was just alone in clinic. So I decided to see her. I told her it's successful. Of course, I won't spend time with you. Happy for you. Congratulations. Yeah, you continue with your medication. You can wait for Dr. Olivier. She may want to see you while. And then she now said, Doctor, do you mind if I kneel down in this office and pray?
Oh my God.
So now it got emotional for me, okay? I said, okay, you can do all of that. You can, yeah. Then she knelt down, 2 to 3 minutes, prayed, and thanked her God. And then I just watched her, prayed. I was like, man, this is really how it is for some people when they succeed.
And so this client, I know the client you're talking about, she had failed earlier.
Exactly.
So this was the second IVF that was succeeding now, yes. So IVF can still succeed after a failure. So let's keep our hopes alive.
Sometimes I take a picture of them, because when you are depressed sometimes for all the failures you've seen,
you get
just a glimpse of what success looks like for some people,
encourages you to still keep at it.
Successful. There's something strange happened in my office. That's this 2 years ago, I think. There's a particular woman who has battled infertility for a while, a minimum of 10 years, for instance. succeeded. I think second attempt too, succeeded. She knelt down in a particular corner of my office. It was a Christian woman, raised her hand. I have a picture, raised her hands, prayed to God and all of that. Then 2 years later, she brought the son that she delivered to just say hello to the doctor.
Oh my God.
Mysteriously, yes, that child stood at that point where his mom knelt, raised her hand and prayed and
I'm
thanked.
getting
And
emotional right now.
yeah, so I was watching and watching and watching and all kinds of things. Okay, what's the coincidence here? The boy wasn't there. He was the one that was conceived at that same point where his mother knelt down and prayed to God. He stood there, and of course, he couldn't talk. He was
What a
just there. And so
beautiful
for me,
sight.
I was connecting all of those. And sometimes they stayed in your office and cried.
Tears of joy.
And sometimes they have all kinds of paint on their face. When they cry, instead of seeing white tears, you see colored tears.
Colored tears, black tears.
So yeah, so it just keeps the emotion balanced. You cry,
Then
you laugh
rejoice.
too. So
Yes.
that's how the job is,
Yeah.
You cry and laugh.
Oh, that's beautiful. I'm sure it's always a beautiful
It
sight,
is, it
seeing
is.
someone rejoicing over a successful IVF. So
Yeah.
thank you, viewers. This is much we can take for now.